images have great influence on society's ethics, especially when it comes to teenage girls. The increased focus is becoming on the body and its perfection. Cosmetic surgery has become a big part of everyday life for many Americans. According to a news report published by American Society of Plastic Surgery is on the rise for the second year in a row. Nearly 219,000 cosmetic surgery procedures were performed on people the age of 13 to 19 years old. This constant obsession with appearance is outrageous. How young is too young? And what would your stance be if you had a 15-year-old daughter wanting breast implants? Plastic surgery can lead to two major problems, biologically and psychologically. Non-medical cosmetic surgery is a growing problem in the United States. There is more than just bruising, swelling, and pain that follows cosmetic surgery. The emotional part of the procedure is just as bad. I would like to convince you that plastic surgery is for the mature only. First, plastic surgery is for the mature. An article published in August 2012 by Catherine Hawthorne from the website Parenting Pink states that what a teen wants is not always what the same person as an adult wants, meaning teenagers make rash decisions. There is always going to be a negative physical outcome of any plastic surgery. But teenagers are growing and developing into young adults. Their personalities are changing and their bodies are going through immense changes. Operations sometimes take 6 months to 1 year to fully recover, and that's not even without a guarantee of a successful operation. A teen must have a level-headed realization on the risks and conditions of plastic surgery. From a research study done with Dr. Glatt and Dina Solomon, a psychologist with Mainline Today, described their concerns for teenagers that are undergoing cosmetic surgery. Dr. Glatt explains, you have to consider what's going on in the brain of the teenager. The patient has to be mature during and after the surgery, along with its recovery. And they have to have realistic expectations on the surgery. Psychologist Solomon explains that there is a misunderstanding of teen development. A girl's awareness of her body image begins in toddlerhood. The way somebody criticizes or critiques her body can leave a negative outcome for the rest of her life, especially during the adolescent years. This is why Solomon expresses that parents need to talk to their teens. They need to talk to their teens about cosmetic surgery and the bigger problems in life. This will help teens realize that there isn't a big urge to undergo cosmetic surgery. Studies and statistics have confirmed that teens with low mental and physical psychology are not good candidates for plastic surgery. Plastic surgery is only for the mature. Teens also have to be biologically ready, and this brings me to my second point. A dependable article published in 2012 by Mainline Today interviewed surgeons to see what the risks of cosmetic surgery is on teens. The first reason is the body parts are not fully developed. Each body part matures at a different age and matures at different rates, meaning it's different for everyone. An example is breast implants, the most common cosmetic surgery out of teens. The breast tissue, as teenagers don't know, is still growing at the age of 17. A girl could very well develop a breast size that is fitting to her needs without undergoing cosmetic surgery. This would also reduce the risk of having silicone and other foreign objects in your body, which is also dangerous. From the same article, Dr. Kirk Brandau explains the long-term effects of implants. Whether breast implants or a facelift, having implants in the body is very dangerous. Silicone, for example, it leaks 20 to 30% in a person's lifetime. This means that there is free-floating silicone in your body and your bloodstream, which is very dangerous. Plastic surgery doesn't just harm a teen emotionally, but it can affect a teen physically, from health conditions to overgrowth and even misdevelopment. Plastic surgery is biologically harmful. My last main point describes what can be done to decrease teenage plastic surgery. A life coach, Ms. Campbell, from Emax Health, offers healthy alternatives for teens undergoing cosmetic surgery. Yes, teens today are downright mean, and bullying has become a very big issue in the United States. But there are so many alternatives to altering a teen's body for forever. Ms. Campbell says teens should be aware of their self-body image and have a positive outlook on their life. This will benefit teenagers for the rest of their lives. She suggests forgetting Hollywood and becoming your own celebrity. Embracing your higher power, putting yourself first, being happy, and remembering your values that you were taught as a kid. These steps can make teens realize cosmetic surgery is not the only option to bullying, teasing, or low self-esteem. A study performed by Dr. Wallace and Dr. Stevens explains how parents can know if and when non-medical cosmetic surgery is appropriate for their teen. Dr. Stevens explains parents are sometimes the problem. Sometimes parents push their kids to act or look a certain way. Parents who put emphasis on their own appearance have difficulty with their children, mostly their daughters, who don't look the same as they would like them to, or the same image that they have for their daughters. Parents need to step back and realize their teen is still growing and maturing, and they should seek other alternatives if a teen is feeling low self-esteem or being bullied. Teenage plastic surgery is a growing problem in the United States. I hope I have clearly explained why plastic surgery for teens is wrong. In a statistical report, 219,000 plastic surgeries were performed on patients ages 13 to 19, ranging from nose jobs to laser skin resurfacing. Plastic surgery is both biologically and psychologically dangerous in males and females under the age of 20. There are so many different avenues to go down before considering plastic surgery for an option. After hearing my arguments, it should be clear that plastic surgery is only for the mature. Plastic surgery should not be performed on anyone whose body is still growing and developing. And lastly, the options that are available to teenagers coping with bullying, teasing, and low self-esteem are endless. Non-medical cosmetic surgery is a growing problem in the United States.